Hey everyone, and welcome to this explainer. Today, we're exploring a piece of medical literature that literally turns heartbreak into hope. We're looking at a fascinating clinical study from 1991 detailing a surprisingly straightforward surgical technique, one that completely altered the course of high-risk pregnancies. It's a brilliant example of how, sometimes the absolute most elegant and life-saving medical solutions are also the simplest. Okay, let's dive into this. 81.2%. Before the intervention we're going to discuss today, the group of women in this study faced a devastatingly low fetal survival rate of just 10.8% in their previous pregnancies. But by using this specific, highly targeted procedure, doctors bumped that survival rate up to an incredible 81.2%. It's a staggering leap in positive outcomes, and we are going to look at exactly how they pulled it off. So, here's our quick roadmap for today. We'll start with the cervical incompetence problem, then we'll introduce Wurm's procedure, explain the surgical technique, look at the 30-patient clinical trial, and finally, break down those dramatically improved survival rates. All right, Section 1, the cervical incompetence problem, the heartbreak of mid-trimester pregnancy loss. So, to make sure we're all on the same page, the study defines cervical incompetence as the inability of the uterine cervix to retain an intrauterine pregnancy until term. Basically, the cervix, which normally stays tightly closed to protect that growing baby, prematurely weakens and just starts to open. According to the source, this accounts for a massive 16 to 20% of all mid-trimester pregnancy losses. It hits right at a critical window where the pregnancy is well underway, making these losses absolutely devastating for expecting parents. Moving to Section 2, introducing Wurm's procedure, a surprisingly simple 15-minute solution. Now, here's where the history gets really wild. Wurm's procedure wasn't actually brand new in 1991. It was first described decades earlier, back in 1961 by Hefner and his team, and named after Dr. Roger S. Wurm from Australia. Those early 1961 reports, they showed an astonishing 100% effectiveness in a small group of 9 patients. But, and this is the crazy part, very little published literature followed. It remained surprisingly underutilized. This historical blind spot is exactly why the researchers in our 1991 study decided to document their own success with it. Section 3, the surgical technique explained, visualizing the Wurm's stitch. Now, what's really interesting about this slide is how we can actually break down this 10 to 15-minute surgery. The surgeons use this intuitively simple clock face analogy to explain it. Just picture the opening of the cervix as a clock. Step 1 is placing a mattress suture starting at the 12 o'clock position, going straight down to 6 o'clock, and coming right back up to 12. Then, Step 2 is just a second mattress suture placed horizontally, going from 3 o'clock straight over to 9 o'clock. Taking a closer look at Step 1, you can see this vertical, top-to-bottom mattress suture placed right at the internal cervical os, which is the inner opening of the cervix. The study notes the doctors used either number 3 heavy braided silk or umbilical cotton tape to get this really robust mechanical reinforcement. And this brilliantly illustrates Step 2. It completes the whole thing with a second horizontal stitch crossing right over the first one. Once both the 12 to 6 and 3 to 9 sutures are in place, they tie them off. Oh, and if the fetal membranes were already bulging out, doctors would tilt the patient back. That's called the Trendelenburg position, and gently push the membranes back with forceps before placing this elegant lattice-like closure. It's basically a tiny, life-saving safety net. Section 4, the 30-patient clinical trial, putting Wurm's procedure to the test at JIJPM or hospital. Now, the timing here is absolutely crucial. Out of the 30 women, only 4 had this done as an elective early procedure. For the vast majority, 26 out of the 30 women, this was an emergency therapeutic intervention done late in the mid-trimester or early third trimester. Doctors performed this only after discovering the cervix was already opening and effacing, meaning thinning out. So we are talking about incredibly high-stakes, stressful medical crises here. Let's move to and see how this builds into Section 5, dramatically improved survival rates, the before and after data. To really grasp how big of a deal this trial was, we have to look at what these 30 consecutive patients went through beforehand. None of them were on their first pregnancy. In fact, combined, these women had 92 previous pregnancies. But from those 92 pregnancies, actually, let me just read the stat. They only had 10 living children. That is, well, it's just heartbreaking. A 10.8% survival rate. It really underscores this devastating pattern of repeated loss caused by cervical incompetence. But look at what happens after Wurm's procedure. The outcome's totally transformed.
Out of 30 pregnancies, they saw 26 fetal survivals and only 4 losses. That dismal 10.8% survival rate absolutely skyrocketed to 81.2%. This simple 15-minute intervention fundamentally changed the trajectory of these high-risk pregnancies, and they did it with remarkably minimal complications, literally just one accidental rupture of membranes during the surgery. You might be wondering why this procedure instead of others. Well, the study actually compares worm stitches to Chiracards and McDonald's procedures, which are other types of cervical stitches. Chiracards can be technically super difficult if the cervix is already dilated. McDonald's is easier, but the authors argue Wurm's is simpler still. It causes minimal tissue injury, there's less significant bleeding, and crucially, doctors can safely apply it even late in the pregnancy. Which brings us to the author's conclusion. They confidently state, "We believe that this procedure is a valuable adjunct to the available cerclage procedures for treating the incompetent cervix during pregnancy." They essentially proved, through rigorous real-world application, that this gentle little stitch isn't just some forgotten historical footnote. It is a highly effective, absolutely essential tool in maternal care. So, I want to leave you with this thought to end our explainer today. If a simple 15-minute stitch invented back in 1961 can boost fetal survival from a tragic 10% to over 80%, what other simple, forgotten medical techniques are out there right now? What else is just sitting in the literature waiting to be rediscovered so it can save lives today? Thank you so much for joining me, and keep questioning the science around you.